Hi everyone, welcome back. So in today's video I will be talking about massage during pregnancy. I will also be doing some other videos following on from this about massage in the postpartum period, whether you've had a natural delivery or a cesarean section. And I will be talking also in videos about self-massage you can do to help promote lactation if you're wanting to breastfeed. And I will be doing videos about pregnancy related issues, so things like your pelvic floor, abdominal separation, postnatal depression, things like that. So certainly if these are things that you're interested in, subscribe and you'll be notified when those videos come online. So for me, obviously having been a midwife, this is an area that I have quite a lot of interest in. And it's surprising how many clients I see for massage following childbirth, where they come in maybe with some back pain, and through the course of the massage it actually becomes apparent that it's quite often due to some sort of pregnancy related issue. So hopefully through the course of these videos I'll show how massage can benefit women right through the sort of pregnancy journey, and then following on from that through the transition into motherhood. But for this video today, we're just going to focus on pregnancy itself and how massage can benefit. And I'm going to try and keep it fairly basic today. So obviously, as I say, I've been a midwife. I had children myself, so I'm pretty aware of the changes that can happen during pregnancy, which, as any of you who have been pregnant will know, can cause some discomfort. As the abdomen grows, to accommodate a growing baby, the whole body's centre of gravity shifts. So this can cause changes in posture, because your body kind of has to accommodate and realign that centre of gravity over the hips. And so the result of obviously this change, postural changes and the change in the centre of gravity is that there's increased stress on the joints and the muscles, which can then cause certainly lower back pain, but also pelvic pain. Any of you that have been unfortunate enough to have SPD, which I will also do a video on, will know how painful that is. Pain around the neck and the shoulders, and also on the sciatic nerve running down the thigh, because obviously that originates right up sort of in the hip. The other thing with pregnancy is that obviously the ligaments and soft tissues around the pelvis will also start to relax and stretch, basically again to accommodate the growing baby, which this can cause sharp pains, usually on one side of the pelvis. And this is really down to the effects of the hormones through pregnancy, which they soften the tissues to prepare eventually for the labour itself. So massage can really be a great way to relieve these aches and pains, but I must stress, if you're going to have a pregnancy massage, please go and see a therapist who is qualified and experienced in this area, because there are certainly many more contraindications to massage, things that you have to be aware of, and you want a therapist who is going to recognise these high risk areas, and be honest with you, and not at the end of the day put you or your baby at risk by carrying out a treatment when it's not appropriate to do so. So please do do ensure that you're seeing someone who's qualified. So in terms of the techniques used in a pregnancy massage as opposed to, maybe a Swedish or a deep tissue, a lot of it comes down to the placement of pressure. Pressure on some body parts during pregnancy, for example, the wrists, the ankles, can actually prompt contractions. So pregnancy massage is much more about subtle movements, so that any such complications, such as premature labour, will be avoided, because I'm sure nobody wants that to happen. So in terms of contraindications and reasons why you shouldn't have a pregnancy massage, there is a long list, but certainly I would say, generally speaking, high risk is if you are someone who is under the care of a consultant for your pregnancy, then there is a fair chance that that's because there's an issue there that would probably be contraindicated, or certainly that the therapist would need to be very cautious about. But certainly things like morning sickness, which, to be honest, if you're experiencing that, you're probably not going to want a massage. Any kind of heavy blood flow, or even a watery vaginal discharge, you want to steer clear of a massage. Any problems with high blood pressure, and certainly preeclampsia, which sort of more as the pregnancy progresses, and can obviously cause fitting. Massage is an absolute no-go. Gestational diabetes is another area where, although with a non-pregnant client, who has diabetes, massage isn't necessarily contraindicated, but obviously in the pregnant client, this changes things. Certainly any kind of high temperature or fever, which, with any client you wouldn't treat. And if there's been any kind of abdominal pain or cramping during the pregnancy, again, you wouldn't carry out a massage treatment. And that's just really, for the safety of mother and baby. Yeah, as I say, there are sort of some other areas where you would certainly at least want to get sort of medical approval from a consultant or doctor prior to treatment. But there's quite a long list, and as I say, if you consult with a therapist who is qualified in this area, they will ask more questions. But these ones that I've mentioned today are certainly sort of the main ones. And another one that, another example of one that you would want to be quite cautious would possibly be something like multiple births, or, if there's been something like an incompetent cervix, which obviously can result in premature labour. These are things, again, that you're going to want to be quite cautious about. It's not necessarily a complete contraindication, but you would want to get further advice. So in terms of the benefits of a pregnancy massage, obviously all of those usual benefits that you will have seen if you've watched my videos on the physical benefits and mental health benefits of massage, certainly all of those still apply. But specifically to pregnancy is what I'm going to talk about now. So one of the things you pregnant ladies will know about is that you can certainly get a build-up of fluid, certainly around the feet and the ankles. Basically this is really just caused by the build-up of pressure on the veins in the legs, as a result of the growing uterus. And that extra weight puts pressure on the blood supply. So massage can really help to reduce the build-up of fluid in the feet and ankles by, obviously we know it sort of promotes lymphatic circulation around the body, and so that's how it's able to relieve this, some of this pressure, on the veins of the lower body. And also, obviously, some of you pregnant women may be unfortunate enough to also experience varicose veins around the vulva, which again can be really uncomfortable. Now obviously there wouldn't be direct massage over any varicose veins, but massage in the surrounding areas, and so of the legs and the feet, and then obviously massage around the back will again also just help encourage this lymphatic circulation and prevent build-up of fluid in the lower body. The next benefit, as we know, massage can really help improve mood and reduce anxiety and stress, which in turn will help promote a good night's sleep. And just overall well-being, really. So we know that massage helps with the release of endorphins and helps to reduce the production of cortisol, which is your stress hormone. So by reducing these stress hormones and helping release those endorphins, those feel-good hormones, that will really help promote just the general well-being, reduce the stress levels and anxiety, maybe anxiety about the pending birth, and just help the mother, generally cope better with the pregnancy, and in the end cope better with the labour itself. And a happy mother and a relaxed mother is going to have a knock-on effect on the baby, and help that baby sort of feel more relaxed as well. If you've got a stressed mother, it's going to, potentially cause rises in high blood pressure, which for any pregnancy is never going to be a very good thing. And as I say, reduced anxiety, reduced stress will again help just with sleeping, which, when you're certainly towards the late stages of pregnancy, it can be quite uncomfortable, and so some women have problems, just getting a good night's sleep. So okay, so the next benefit obviously is on the hormones. You've got a whole different balance of hormones during pregnancy, so which again can affect, stress levels and all sorts of other things, to do with the body systems. The effect of massage on the hormones, as we know, can encourage relaxation, not only, as I've said, during pregnancy, but during the labour itself. And it's actually also been shown that women who have regular massage during pregnancy also tend to be at a lower risk of developing sort of issues actually during the labour itself, and therefore requiring interventions, so things like forceps delivery, or maybe having problems with hemorrhages, or retained placentas, and things like that. So it's, as always, a one-off treatment will make you feel good, but having those regular treatments will really make a much bigger difference, in the long run. So another benefit of massage during pregnancy, as we've said, in order to accommodate the extra weight of the growing baby, we tend to kind of have an altered posture during pregnancy, because, the centre of gravity in our bodies changes. So this tends to cause backache. So what massage does is, by assisting with the blood circulation, and also by eliminating, any further strain on the spine itself, on the vertebrae. Massage can help to prevent any postural imbalances. While obviously our posture is in a slightly altered state during the pregnancy. Massage will also help to prevent and reduce stretch marks. We know massage has benefits in terms of nourishing the skin, and obviously during pregnancy, as the baby grows, towards the later stages, the skin can get really tight, and this can cause the stretch marks. But what massage does is it just helps to keep that skin nice and supple and elastic. Certainly I remember when I was pregnant, I was, probably a bit OCD with sort of preventing stretch marks, and from about 10 weeks I got a great oil. It's actually, you can get it in Boots. It's the Sanctuary range, and they had this body oil spray, and I actually used that every morning and every night across the stomach, hips, thighs, and I didn't get a single stretch mark. So, and I was quite big with my pregnancies. So, yeah, I'd say, if you're worried about stretch marks, certainly do that as well, just yourself, from about 10 weeks. And yeah, hopefully it won't be too much of an issue. Okay, so the next benefit, getting off track a bit there, is in terms of relieving sciatica pain. The sciatic nerve, it's biggest nerve in the body. It's about the same size as your index finger. So you can understand why when people have sciatica, it's really painful, because it's a big nerve. So the sciatic nerve is located at the back of the thigh and going into the hip area. The piriformis muscle, when I do a video on the glutes, you'll see, and I will actually also do a video on sciatica, but the piriformis muscle actually wraps around the sciatic nerve within the glutes. So if that's tight, that's another reason why you can get sciatica symptoms. But with regards to pregnancy, this nerve can become compressed just because of the extra weight. pushing down on that nerve and consequently causing pain. So by helping to maintain the blood flow and by relaxing the muscles and just helping to release any pressure that may be placed upon the nerve, through not only the extra weight but also through tight muscles, massage can help to reduce any sciatica symptoms during the pregnancy. So also in terms of reducing joint pain and also anemia, one of the common things during pregnancy is to be deficient in iron, which of course is responsible for producing your hemoglobin, your red blood cells, which in turn helps with your energy levels because the blood transports the oxygen and the nutrients to the tissues. So yeah, pregnancy-related anemia is common, but through massage and its benefits on the circulatory system, combined with diet, will help, to increase lymph and blood flow through the body, which it will also help increase hemoglobin as a result. So this enhanced blood count obviously not only will impact on your energy levels through the pregnancy, and hopefully you'll feel a little less tired, but it can only benefit baby as well. Another benefit, something that I suffered with like pretty much every day during my pregnancies, was heartburn. Certainly towards the later stages of pregnancy, the digestive system will become a bit more sluggish, which certainly commonly causes heartburn. You might also have problems with constipation as well, just where the bowels become a bit slow and as I say, sluggish. Also, heartburn and constipation are going to be exacerbated by stress, which, towards the later stages, a lot of women find that more stressful, certainly if they're first timers, maybe through worry about, how the labour's going to go, or how am I going to cope with this new baby, or, so massage may actually help with this by, as we know, reducing anxiety through the reduction of those stress hormones such as cortisol, and easing stress levels. It can then in turn, help to reduce heartburn and constipation if it's being made worse by stress. Obviously, we know stomach massage usually is great for constipation and the digestive system. During pregnancy, you don't really tend to do much of an abdominal massage. It's more around the back, in the leg areas. But certainly it will still, help with the digestive system. Certainly another thing in terms of the joints, I did briefly mention before about SPD, which is symphysis pubis dysfunction. So I will do a video specifically on this, but SPD is basically where there's at the front of the pubic bone in the middle, there's actually a little piece of cartilage that separates the left and the right sides of the pelvis. So what happens with SPD is that the effect of the hormones on the ligaments, it causes the ligaments, to relax, which causes instability in the hips and also pain around the groin and the hips. And sometimes what happens is this cartilage also then kind of gets misplaced. So yeah, massage can also help just maintain sort of muscle tone and strength, and just that in turn can then help just support that, the pelvis and the hips, and maintain some hip stability a little bit more. Another benefit of pregnancy massage, now this, isn't something that a therapist like myself would do. This is something in terms of you yourself doing some self-massage, and that's self-perineal massage, which can really help to prepare the perineum for labour. It can also help to improve the skin integrity and the elasticity of the muscle tissue. And so what this means is that when it comes to the labour, it means that hopefully you will have a reduced risk of tearing, and therefore a reduced risk of having an episiotomy, of having stitches afterwards. And certainly, we know that tearing during childbirth can cause problems with pelvic floor weakness, problems with constipation, and problems even in subsequent pregnancies. So certainly this is something that you can look into yourself, doing at home. Okay, now another thing that I am we've just, before I talk about that, we've just touched on the pelvic floor, which again I will be doing another video on, but pregnancy massage can help, if you're having it regularly, it can help to improve any weakness in the pelvic floor, maybe through previous pregnancies, which again, as we said, can cause continence issues, but also things like prolapses and other symptoms such as back pain. So even having massage during the pregnancy, but also having massage afterwards, can certainly help to restore normal function of the pelvic floor, ease constipation, and in terms of prolapse, I will discuss this more in the video that I do on pelvic floor, because it depends on the severity of that prolapse as to how much massage can do. So another benefit is, and again, this is something I will talk about in a separate video, and another thing that you can do in terms of self-massage, and the video that I'm going to do will actually show you how to do a self-breast massage. So it can massage can be helpful in terms of helping to establish breastfeeding patterns, also reducing mastitis, where your breasts become really engorged and heavy and painful. And let's face it, we've all heard the thing about using cabbage leaves on your breast for mastitis. Massage is probably more enjoyable than having cabbage leaves on your boob. And massage can also help really just with the whole lactation process, improving milk flow, breastfeeding. It's great if you can do it. We all know the midwives all promote breastfeeding, but some women really have problems with this through no fault of their own. I will be showing how massage can help with this in another video. So as I say, subscribe and you'll be notified when that one comes out. Another, obviously we talked about pelvic floor problems following pregnancy. One of the other issues that I've actually seen a lot in postnatal women, and again I am going to do a separate video to talk about this issue and how you can deal with it, is abdominal diastasis, so basically separation of those abdominal muscles. you know, and this really happens due to, again, just due to the growing baby, you know, and the softening effect of the relaxing hormone. And both of these things together will basically, you know, cause a reduced strength in the abdominal wall, in those rectus abdominis muscles, which, you know, if you look at a man, that's their six-pack muscles, it's those muscles. And so if you have reduced strength in these muscles, what that then does is causes a lot of lower back pain, which is what I've seen, you know, in practice. It can also cause pelvic instability. So again, in terms of, you know, if you have abdominal separation and then subsequent pregnancies, you know, it can actually cause problems. So you really want to get it sorted, you know, as soon as possible, and certainly before having, you know, further pregnancies, because it can also, you know, it can cause problematic vaginal delivery. So, you know, obviously, which then increases the likelihood of things like forceps, ventouse, which is like the suction cup on the baby's head, you know, and even cesarean sections. So, but as I say, I will do a further video on that specific issue. So yeah, you know, quite a few benefits of massage during pregnancy. And you know, the benefits certainly continue into the postpartum period, following, you know, immediately following childbirth, and even following cesarean section. And I'm gonna go on to do, my next video actually will be on massage following labour, whether it's a natural delivery or a cesarean section. And as I say, I will also be doing shortly a video on self breast massage to help with breastfeeding problems. And I will be doing a video also on the abdominal separation and also on the pelvic floor. And these videos will include exercises that you can do to help with these issues. So do keep your eye out for those. As I say, subscribe, you'll be notified when these videos come out. And feel free to comment below. Contact me through my Facebook or Instagram with any questions you may have. Yeah, I will see you next time for the postpartum video on massage. Okay, but until then, take care and I'll see you later. Bye.